Maple syrup urine disease, MSUD. MSUD is marked by a distinct maple syrup or burnt sugar smell in urine, sweat, and earwax caused by a buildup of sweet-smelling byproducts like sotalone. This happens because of a genetic enzyme defect that blocks breakdown of the branched-chain amino acids leucine, isoleucine, and valine. Symptoms usually appear in newborns within days: poor feeding, vomiting, and extreme sleepiness. Without treatment, toxic buildup can lead to seizures, coma, and death. Even in milder forms, long-term neurological damage can occur. The smell is often the first clue, noticed in a diaper, on skin, or in clothing, and helps alert caregivers before lab tests confirm the diagnosis. MSUD is rare, affecting about 1 in 185,000 births, but is much more common in some genetic populations, including Old Order Mennonites. Early diagnosis and strict dietary control of protein are essential to prevent irreversible brain injury. Diabetic ketoacidosis, DKA. This life-threatening complication of diabetes produces a distinct fruity odor on the breath, often compared to overripe apples or nail polish remover, due to the buildup and exhalation of acetone, a type of ketone. DKA occurs when insulin levels drop too low, preventing cells from absorbing glucose. This is more likely to happen in individuals with type 1 diabetes, with poor blood sugar control. In response, the body breaks down fat stores for energy, generating ketone bodies: acetoacetate, beta-hydroxybutyrate, and acetone. As these acids accumulate, they cause metabolic acidosis, severe dehydration, and high blood sugar. Acetone, being volatile, is exhaled through the lungs. Its sweet chemical scent is often the first clinical clue, especially when paired with deep, rapid breathing and altered mental status. The urine may also smell sweet due to excess glucose and ketone excretion. Before insulin therapy, this odor signaled impending death in diabetic patients. While ketosis can occur in other settings, like fasting or ketogenic diets, the intensity of the fruity breath in DKA is typically more pronounced and signals a medical emergency requiring immediate intervention. Isovaleric acidemia. Isovaleric acidemia causes a strong odor like sweaty feet or pungent cheese, noticeable in a baby's sweat, breath, and urine. The smell comes from isovaleric acid, which accumulates due to a missing enzyme needed to break down leucine. This acid exits the body through secretions, producing the classic sweaty feet odor that can alert caregivers. The disorder is a rare autosomal recessive condition caused by isovaleril-CoA dehydrogenase deficiency. When untreated, it can lead to vomiting, dehydration, metabolic acidosis, and in severe cases, brain swelling or death. Milder forms cause poor growth and developmental delays. First reported in 1966, the disease's odor was a key diagnostic clue. Treatment includes limiting dietary leucine and giving glycine or carnitine to clear isovaleric acid. The smell may return during illness or stress. Interestingly, isovaleric acid is the same compound responsible for normal foot odor and the sharp scent of cheeses like Parmesan. Anaerobic infections and gangrene. Anaerobic infections like gas gangrene give off a horrifying, rotting flesh smell, often described as decaying meat. This stench comes from bacteria like Clostridium perfringens that thrive in oxygen-starved tissue. As they break down flesh, they release foul gases such as hydrogen sulfide, putrescine, and cadaverine, the same chemicals that create the death smell. Gas gangrene destroys muscle rapidly and causes swelling, pain, and gas-filled blisters that ooze a sickening odor. Necrotizing fasciitis and infected ulcers can produce the same scent, especially in untreated wounds. The smell is unmistakable, sweet, putrid, and instantly alarming. Modern antibiotics have made these infections quite rare, but they can still occur in untreated war injuries or neglected wounds. During World War I, medics sometimes identified infected soldiers by smell alone, amputating limbs to save lives. Trimethylaminuria. Trimethylaminuria causes a strong, rotten fish odor that leaks from sweat, breath, urine, and reproductive secretions. This comes from a buildup of trimethylamine, TMA, a compound that naturally smells like decaying fish. In healthy people, TMA is broken down by a liver enzyme, flavin monooxygenase 3, but in this condition, the enzyme doesn't work properly. As a result, TMA is released unchanged through bodily fluids, creating a persistent and unmistakable fishy smell. The condition is inherited and usually harmless to the body, but devastating socially. TMA is produced when digesting choline-rich foods such as fish, eggs, and beans. Stress or menstruation can also make the smell worse. Normal hygiene doesn't mask it, and many people who suffer from this condition face isolation, depression, and anxiety. Though rare, affecting as few as 1 in a million, its emotional toll is heavy. Kelly Feto White from the UK spoke publicly about how fish odor syndrome shaped her life from childhood through adulthood. Her story underscores the importance of diagnosis, dietary changes, and support in managing this silent but socially overwhelming disorder. Pseudomonas infections. Pseudomonas infections are known for producing a sweet, grape-like, or corn tortilla smell that can come from infected wounds, dressings, or even a patient's breath. This odor comes from the bacterium Pseudomonas aeruginosa, which releases a chemical called 2-aminoacetophenone. This compound creates the scent often described as artificial grape, taco chips, or fresh-cut hay. Pseudomonas aeruginosa commonly infects burns, open wounds, and the lungs, especially in people with cystic fibrosis. Infected sites may produce greenish-blue pus or thick mucus, both carrying the distinct sweet odor. Nurses and doctors often notice this smell during wound care or when treating lung infections. In hospitals, this bacterium is a frequent cause of ventilator-associated pneumonia and burn wound infections. The same chemical is found naturally in certain wine grapes and flowers, which explains why the smell can seem oddly pleasant. However, a strong grape-like odor from a wound or sputum usually signals a serious infection needing immediate treatment. Fetor Hepaticus. Fetor Hepaticus is a sweet, musty odor on the breath that signals severe liver failure. This smell comes from sulfur-containing compounds, mainly dimethyl sulfide and methyl mercaptan, that build up when the liver can no longer filter toxins from the blood. These chemicals are exhaled, giving the breath a scent often described as sweet and fecal, like freshly cut hay, rotting garlic, or a damp cellar. Some compare it to the smell of a dead mouse, a classic clue of advanced liver disease. This odor appears in people with end-stage conditions like cirrhosis or severe hepatitis. As the liver fails, other signs develop, including jaundice, fluid buildup in the abdomen, confusion from toxin buildup in the brain, and easy bleeding. Fetor Hepaticus is common in patients with hepatic encephalopathy and late-stage liver damage. Studies show that over 80% of patients with severe hepatic encephalopathy have this odor. While mild liver disease may show no clear signs, advanced failure often produces a smell that experienced healthcare workers recognize immediately, sometimes even from across a room. Multiple carboxylase deficiency. Multiple carboxylase deficiency is known for a sharp tomcat urine odor that comes from an affected baby's skin and breath. This pungent, ammonia-like smell resembles male cat urine and results from a buildup of certain organic acids when the body cannot properly use the vitamin biotin. The exact chemicals causing the odor are not fully defined, but the scent is distinctive enough that it once helped doctors suspect the diagnosis. This autosomal recessive disorder disrupts multiple biotin-dependent enzymes due to either biotinidase deficiency or holocarboxylase synthetase deficiency. When these enzymes fail, organic acids accumulate and cause metabolic stress. Untreated babies often develop severe skin rashes, hair loss, seizures, and developmental delays. Without biotin supplementation, these problems can become life-threatening. Before routine newborn screening, parents or nurses sometimes notice the cat urine smell along with rash and illness. Today, screening catches most cases before symptoms appear, preventing the odor and complications. Early high-dose biotin treatment corrects the enzyme dysfunction and stops the tomcat urine smell. Hawkinsinuria. Hawkinsinuria is known for giving an affected baby's urine a sharp chlorine or swimming pool odor. Parents often notice a bleach-like or pool water smell coming from a baby's diaper, which is an unusual clue among metabolic disorders. This scent comes from an abnormal metabolite called Hawkinsin, which builds up in the urine when the body cannot fully break down the amino acid tyrosine. This ultra-rare condition is autosomal dominant and caused by a mutation in the enzyme 4-hydroxyphenylpyruvate dioxygenase. When this enzyme does not work properly, tyrosine metabolism is disrupted, producing Hawkinsin and other byproducts that lead to metabolic acidosis and ketosis in early childhood. Affected infants may have poor weight gain, acid-base imbalances, and temporary fine, sparse hair around the time of weaning. Hawkinsinuria is extremely rare, with fewer than 20 cases reported worldwide. If caught early, mild protein restriction helps manage symptoms, The chlorine odor and other signs often fade as the child grows and compensates, allowing normal life without long-term treatment. Tyrosinemia type 1. Tyrosinemia type 1 is marked by a strong odor of boiled cabbage or rancid butter that comes from a child's skin and breath. This smell is caused by toxic tyrosine byproducts, mainly succinylacetone and sulfur compounds, that build up when the body lacks the enzyme needed to break them down. These substances exit through sweat and fluids, creating the cabbage-like or sour, oily odor that often alerts caregivers and doctors. This is an autosomal recessive disorder and caused by a deficiency of the FAH enzyme. Without this enzyme, toxic intermediates damage the liver and kidneys, a condition also called hepatorenal tyrosinemia. Infants usually show signs in the first months of life, including failure to thrive, vomiting, an enlarged liver, jaundice, and a bleeding tendency. Without treatment, the disease often leads to liver failure or liver cancer and can be fatal in early childhood. Tyrosinemia type 1 is rare worldwide, but more common in certain populations, like the Saguenay region of Quebec. Newborn screening for succinylacetone now helps catch this disease early, so treatment with diet and nitasinone can prevent liver damage and the cabbage odor.